Wait, hold on. Don't go anywhere. Somebody asked me a question and I just have to answer it. So don't go nowhere. Stay here so I can all right, team. How y'all doing today? I'm so excited to be here live with you. I am the real Alisa Applewhite, your CEO 3 times, and let me show you what we are bringing you today. All right, so this is episode number 86. What is the hiring process in healthcare staffing agency? All right, y'all. So I am your CEO 3 times. Let's get to it. I'm going to respect your time like you always respect my time. Let's get to the banners. So, question, why do I go live Monday through Friday, y'all? It's simple. I go live because people keep DMing me, emailing me, texting me, calling me, asking me questions about healthcare staff, and not only just healthcare staffing, about businesses, about being a wife, about being a mom, right? About being a friend, just asking me how do I balance it all. And I just wish sometimes I could have 15 minutes to answer that question. So I said, boom, you asked me the question and I'm going to answer it. So I go live Monday through Friday to answer whatever question, as long as it's appropriate. I'm going to answer whatever question it is. So I'll give you 3 things on what I think the answer is to the question based on the research, the history, and stuff that I have. And then you can take it and utilize it to put value into your life, value into your business, right? So that's why I go live Monday through Friday. You can catch us here at 12 o'clock every day, Monday through Friday. And on Saturdays and Sundays, we have recordings. So if you didn't catch an episode before, you can catch it on Saturday and Sunday. You can always go to our YouTube channel and just like binge watch all our episodes. I promise you, I have said this when I'm looking at these episodes myself. If you put these episodes together, y'all, you can build a healthcare staffing agency from scratch yourself. If you put these healthcare, I feel like I got some of my eyes. I see it. There we go. If you put these videos together, you can build your own healthcare staffing agency from scratch. So go ahead, y'all. Like go for it, right? And it's episode 86. So I answer 86 questions live, y'all. All right. So the next question that I always get is, why do they call you CEO 3 times? Y'all, it's real simple. Me and my husband have 3 companies, right? So I was sitting there and I was talking to him like, yo, most people, are CEO 3 times and they don't even know it. Like, you're a CEO in business, right? If you have your own business, if you're a mom or a dad, you're a CEO parent, right? And then if you're helping your family, your friends, you're a CEO in your community. So everybody is at least a CEO 3 times. So be looking out for those shirts because I'm going to be selling that. You need to know I am. I had to really think about it. We all are CEOs 3 times. We doing something. Is we play 3 different roles in our lives, y'all. So, but we made this one because we had 3 companies, right? So I love the number 3. I love the power of 3. This is the name of our companies, right? So me and my husband have top of the line healthcare staffing, which is a healthcare staffing company that staffs medical professionals, hospitals, doctors' offices, and nursing homes, right? And then we have TOTLHS Heart to Go Inc. That is our nonprofit. That is our baby that staffs that gives medical professionals, right? So it takes care of the holistic medical professional. This is the one that we are infusing and gonna grow it to the max because we want to take care of the holistic medical professional. Like that's big for us. All right. And then company number 3, the real Alisa Applewhite Consulting. This is the consulting company that has brought you questions live, questions live and answers with your CEO 3 times. That's me, Alisa. And not only does it do that, but we help everyday people to build a healthcare staffing agency from scratch to government, right? We have partnered in school systems where me and my husband actually go and motivate children and teach them the principles of building wealth. Like it's so awesome, right? Helping is just so great. We also teach medical professionals how to be the best medical professional they can potentially be, right? We have a business model for that. We partner with hospitals and nursing homes to show them how to retain staff. And people, they always question me that, why would you show the competition how to retain staff? Because anybody who knows me, anybody who watches me know that I have one goal. I have one goal in healthcare. And that's just to make sure that I'm putting professional, accountable, and compassionate medical professionals at the bedside, staffing through me or staffing through the hospital, right? At the end of the day, the only one who suffers when there is nobody to take care of them is the patient. Okay. So people can do this for their own reasons. Yes, the money's great. Yes, it's great putting staff at the bedside. Yes, we are changing lives. But the ultimate goal, the ending goal, is to make sure that patient has somebody at their bedside. All right. So we do that. We have a podcast called Beyond the Scrubs Podcast. You need to be on it. If you're not on it, what are you doing, right? We take everyday people like you and we listen to your stories, right? Not only do we listen to your stories, we let the world hear your stories. If you're a medical professional, we want to hear your stories. We let the world hear your stories because we really want people to know that healthcare is just a universe by itself. It really is. All right. So let's get to it. I got 9 minutes on the clock. Y'all know I'll be trying to respect that clock. So the question for today's episode number 86, what is the process in healthcare staffing agency? Good question. I'm so glad somebody asked this question. All right. So I'm going to give you 3 things on what I think the process is in a healthcare staffing agency. So the first one is going to be hiring your team, right? So what is the hiring process in healthcare staffing agency? You have to hire your team, and your team can consist of you. It can consist of a scheduler. It can consist of a recruiter. It can consist of a fulfillment person. It can consist of HR, and it should consist of HR. It can consist of social media team. It can consist of a concierge service. It can consist of account managers, a secretary, right? So what is the hiring process in the healthcare staffing agency? You have to hire your team. And what we teach in healthcare staffing is to hire, when you are starting a healthcare staffing agency from scratch, even if you got money, y'all listen to me, even if you got money, for the first 3 months, at least minimum of 3 months, you need to do it yourself. So you can know the positions that are happening in the company that you're building, right? You need to know what's going on. Even if you have thousands of dollars and you want to hire people, what ends up happening is you're hiring people and you don't even know what their position entails, right? So if you're like, Alisa, look, I just don't want to do the work. I don't want to do it by myself. I just want to hire a bunch of people. Awesome. You can do that too. But then get a consultant like me or like Tiffany Jennings or Brenda Harris or Nicole Cayer, right? Those are specifically healthcare staffing women that I know that consult to help you along the way. So you're not just throwing away your money by hiring people, right? So you want to hire your team. This is the first process. This is the hiring process in healthcare staffing agency. And when I say your team, I mean hiring office staff first, right? So again, if you're doing it by yourself, you are your first hire. You need to figure out, what are you doing in your business? What are the roles in the business? How are you going to compensate people in the business? What are you going to provide in that business? What benefits are you going to give in that business? When you are hiring somebody in the healthcare staffing office side, because that matters, right? You don't want to be the healthcare staffing agency that keeps going through staff, right? You need retention and you need people that's going to stay. And I talk about this. I talk about this on one of these videos on how to keep your staff staying, right? Um, so that's the first thing you want to do. You want to hire your team, whoever you choose that to be, if that's you or strangers, but hire your office team. All right. So the next one is boom, hire your compliance team. So this is recommended. You cannot have a healthcare staffing agency if you don't have a compliance team. Question, Alisa, what is a compliance team? I'm answering questions and questions. How about that? Right? A compliance team is somebody who makes sure not only is your office staff legally working and have provided the paperwork needed to work in that state or that city, right? Your medical professionals are legally working and have provided the information to I gotta bring this in just a little bit. Provided the information to work legally in the state within that board, within that medical license or certifications that they're supposed to have, and within that facilities requirements. And I say this because there are requirements for the state. The state says you got to have a license. For example, if you're a nurse, right? If you're a registered nurse, the state says you have to have a registered nurse license registered with the board of that state. So North Carolina, with the North Carolina Board of Nursing, NCBON, right? You have to be registered there. You can Google it, put somebody's information in to see what their license is, right? So you have to be there. That's what the state says, right? The state says they can't have any heinous criminal charges to work in facilities. They can't have any facilities charges as far as abuse on patients and stuff. Right. So that's the state. Then you have the facility. Now the facility say, look, I understand that, but in order to hire them, they can't have marijuana. They can't test positive for marijuana in their urine. We want, instead of you testing for 8 different drugs, we want you to test for 16 different drugs, right? So these are compliance things that you will have with your facility. Your facility will say, hey, this is really big in nursing homes. People have to have dementia training, right? So the question is, who's going to provide the dementia training? Am I going to provide the dementia training as an additional training to my staff? Or am I going to let my client provide it? And then this is how they reimburse me by paying my staff when they enter the building, right? So when you are hiring a healthcare staffing, when you are doing the healthcare staffing hiring process, you need, this is without an option, hire your compliance team. Your compliance team can consist of you as the owner. It has to be a human resource person. So say if you don't know somebody with human resource background, get a consultant. This is very important. Human resource consultants. Now I have one, her name is Talia Rodriguez, right? Is it Rodriguez? I don't think her last name Rodriguez. It's Talia, right? And you can say Talia in here, right? Or HR consultant in this video, and I will give you her information. She consults with companies on the laws of the different states that change in HR. Like she changed my life. She changed my life, y'all. Listen to what I'm saying to you. So she can make you legal. She tells you the stuff to keep you legal while you're running the business. So make sure you get a hire your compliance team. And what Talia does that I absolutely love is, if you hire her as a consultant, like if you by yourself and you hire her as a consultant, she will look for, she will do the applications and all that stuff and look for your team if you want an in-house HR team. And then she will consult with your team along the way, but also consulting with you. So she's not just like, I'm in this for money. I want your business to grow. And not only do I want your business to grow, but I'm going to look out for the owner and make sure that HR person that I put in place is doing what is supposed to be legal. That you need stuff like that. You need people like that on your team. All right, so we got 2 minutes left. And the third one is, what is the hiring process in healthcare staffing agency? Hire your medical professionals, right? So first you want to hire your team, then you want to hire your compliance, then you want to hire your medical professionals, right? So the reason why I made this the third process is because your team needs to know what they need to do, right? The compliance team needs to know what type of medical professional you're hiring and what are the compliance requirements for them to work in that state and in that client's building, whatever client is, if it's a nursing home or hospital. And listen to what I tell you, hospitals have way more recommendations and way more requirements than nursing homes. Okay. So, you have to pay attention to that too. You got to pay attention to your client. Ask your client questions like, hey, do you require any additional training from our medical professionals? Do you require a 6-month training, 3-month training, a year annual training? Like, tell me, does this work for you, or do you need me to add more? And if you have to add more as a healthcare staffing owner, you can add it yourself and just eat the cost, or write it off. You're gonna write it off anyway. Or you can put it in your contract and have your client eat the cost, that specific client, if they require something additional, right? So you're going to hire your medical professionals. All right. So we're getting down to 1 minute. And I want to respect everybody's time. So let's get to the question. Boom. What is the hiring process in the healthcare staffing agency? Number 1, hire your team. Number 2, hire your compliance team. And number 3, hire your medical professionals. All right, y'all. So again, I am the real Alisa Applewhite. I want to make sure you are following me on all social media platforms. The real Alisa Applewhite. You cannot say you can't find me. It's the real Alisa Applewhite on all social media platforms. Make sure you subscribe to my YouTube channel now. Like, regardless of what you're doing, do it right now. Like, stop and do it now. The real Alisa Applewhite. The real Alisa Applewhite. I want to come to you again like I always do and tell you, look, I'm so glad you're here with me today. I'm so glad you're here and breathing. I'm so sad for the things that's happening in Israel. I am praying for those families. I'm praying for those kids. I'm just praying for them, y'all, because humans are humans, period. I don't care what God we believe in. People are people and humans are humans, period. So my heart spills out to them, right? But what I'm telling you is I absolutely love you. I'm so glad that you decided to spend today with me. But I promise you there is no love like the love that God gives you. So please go out today and build a relationship with your creator, because nothing will sustain you like the relationship that you build with your creator. All right. So that is it. I actually did it on time. Love y'all. See y'all next time. Bye-bye. Oh, no, I'm not ending it just that way. Wait a minute. Hold on. What we going to do? What we going to do? Oh, let's play this. Healthcare is affected by everything, right? You could be walking and have a stroke or have a heart attack. Now you are in the healthcare system, right? You can just all of a sudden start having mental issues, and now you're in the healthcare system, right? You could be minding your business and somebody can come in and shoot you, or hit your car or something like that, and now you are in the healthcare arena. And this is why healthcare is so important to me, because to me it matters who's at the bedside, right? So I always say to people, it doesn't matter to me that I have a nurse that say, hey, I'm a nurse, or I'm a CNA, and they show up at the building, right? That doesn't show me their integrity. Their integrity, their accountability, their professionalism, it shows when the door is closed. That is how you know how true a person is to their mission of being a healthcare professional, right? It's how they treat the patients with the doors closed. And my goal is to help to educate healthcare staffing owners and also medical professionals, and again, hospitals, on how to help medical professionals get back to that mindset of how to treat people when the door is closed.